Have you been misdiagnosed and maybe you really have Lyme disease? Let's find out. Hello and welcome to another edition of the Ask Dr. Pickel show. And all right, so today we want to talk about an interesting thing that you may find out more information from this video on, and that's that there are many people out there that have been misdiagnosed, meaning you've had a set of symptoms, you went to your doctor, he said, hey, you have this, here's your medication, you're going to have to live this way. It's usually a chronic condition, and we'll talk more about those potential diagnoses. But is that really it? Were they right? Are you meant to live this way the rest of your life with this condition? Or is there another diagnosis? Could you have Lyme disease? Many people are never even told that that's an option. People are never tested for that. It's never even looked at. The only reason why a person would think they would got that is if they saw a tick bite them or on their body, and then also usually they'll get a rash. And really, if you go to the emergency room, and even if they don't see the rash, they usually say you're fine. Or if you don't get symptomatic, usually you're told you're fine. Again, it's very frustrating. But well, let's even go a little further. Even the CDC knows that 50% of people who get Lyme disease don't even remember getting bit by a tick. So you don't even have to know it, especially if it's these really tiny deer ticks that bite you. You wouldn't even know it, especially if they fell off on their own and you never got the rash. All right. Well, let's go a little further with this and get into this a little more. Okay. So the common symptoms when people get bit by a tick that has Lyme, or if the Lyme actually enters their system, is they get some fatigue, they get some headache, rash, like that bullseye type rash, flu-like joint pain, swollen lymph nodes. I mean, a lot of times people just think, oh, I just got the flu. But in fact, the other side of that is these symptoms, they don't even have to occur. You don't have to really have any of these. They don't have to happen. But you could still get the Lyme and then end up with it affecting you later on. So this is where we have to look at this, because these few symptoms, whether you get them or not, can turn into this. So a lot of symptoms here, a lot of different areas of the body that can be affected with Lyme disease. We call it the great imitator because it can imitate other conditions. So the thing is Lyme likes to attack the brain and nervous system. It likes to attack joints, muscles, ligaments, tendons. It can affect organs. It can affect systems. It can affect you at a cellular level. Not good. But if it attacks the brain or the nervous system, you've got this whole list of symptoms here. That's a lot. Memory, confusion, feeling like you're losing your mind, pressure in the head, headaches, numbness, all kinds of, just read through that if you get a chance. There's a lot there. Gastrointestinal symptoms that affect the gut, the stomach, even the urinary tract shows up on this one too. And then face, head, and neck area, jaw pain, twitching of the face, decreased hearing, just double vision. So many things on here. Some of these are more neurological, some of them are more musculoskeletal too. And then heart and lungs, heart palpitations, shortness of breath, genitourinary, pelvic pain, changes in menses, definitely. And then I think I got on here twice, gastrointestinal, muscles and joints. Absolutely. This is one of the areas that shows up in so many people. And I would say with joint pain, it's often what we call migrating joint pain, where it'll change. 1 week is maybe in your shoulder, and then it's like, hey, my shoulder got better, but now my knee's bothering me, and it just becomes this thing of, oh, maybe I'm just getting older, or the doctor will say that. But definitely we have to look for all of these symptoms, and especially if they start to get proportionate enough, that's usually when you may go to the doctor and they'll try to offer a diagnosis, which usually isn't Lyme. And then if you have these symptoms, if you get a diagnosis, a lot of times you're going to be diagnosed with either fibromyalgia, chronic fatigue syndrome, or chronic fatigue immunodeficiency syndrome, because again, Lyme attacks your immune system. It lowers it. So this can mimic CFIDS and CFS, Autoimmune conditions, so many autoimmune conditions out there. So they can all potentially be either driven and made worse, or actually Lyme could be imitating them. So we want to find out on that. Neurological disorders, because it attacks the brain, inflammatory arthritis, multiple sclerosis, it attacks the brain, Alzheimer's and dementia. Again, these are neurodegenerative conditions. The brain is degenerating. Why? Yeah, is it being attacked by Lyme? And that's been undiagnosed, possibly. Chronic cough, immunocompromised. You get sick a lot. Some people say, oh, I just get sick all the time. I always catch everything that goes around. Well, what is compromising your immune system? Could it be Lyme? Rheumatoid arthritis, depression, polymyalgia rheumatica. Post-Lyme treatment's an interesting one. This is where you go in and they find that you did have Lyme. They treat it usually with antibiotics, and you don't get better. You actually continue to get worse. Now you're in this diagnosis of post-Lyme treatment disorder, which is sad because, and it's also sad that the conventional medical community does not accept chronic Lyme as a real diagnosis, even though it's profound in the research. So again, it is looking at this different perspective. Could your condition be caused by something else, and could it be Lyme? Don't always just accept chronic diagnosis, something you're going to have to live with the rest of your life. Find out answers, and if you find those answers, then you can go even further in treatment. And the thing is well, in fact, what I'll do is I'll put a link to our video on Lyme, which is a little bit of a longer video, but it does go into all the details of this and gives you more information on diagnosis and treatment and things like that. All right. Well, hopefully everybody enjoyed this today. Have a wonderful day, and I'll see you next time.